Well, thank you very much. We're joined by the Minister of Health from the Republic of Uganda, Honorable Dr. Pastor Cristina Ondoa, who has been extremely gracious and very helpful and a very strong voice in the launch of the Stand Up for African Mothers campaign today. I just wanted to ask you, Honorable Minister, first and foremost, just let the world know the current situation of maternal and child health in Uganda.
Currently, our maternal mortality rate stands at 435 per 100,000 live births. This is still very, very high because the world average for maternal mortality rate is 400 per 100,000 live births. But we are patting ourselves on the back because in 1990 our country was at 527 deaths per 100,000 live births. But even at this current rate, which is still very high, we want to reduce this further to about 131 in order to meet the Health Millennium Development Goal number 5. The infant mortality rate is not good either. We are at 76 deaths per 1,000 live births. And we also want to reduce this further if we have to meet the Millennium Development Goal number 4. Yeah.
Thank you, Honorable Minister. And you've just been appointed the Minister for Health for the Republic of Uganda. It's a great opportunity for the country. We are very much aware of your great passion and commitment in the transformation of the health sector, but maybe if you can just let us know what your plans are, especially for addressing the health sector generally, but also specifically issues to do with the health of mothers and children.
Thank you for that question. First and foremost, I want to support what the government initiatives already are in place. And as a Minister of Health, I am the overall supervisor of the policies at the Ministry of Health. And health issues concern many other ministries as well. For instance, the Ministry of Education, the Ministry of Finance and Planning, the Ministry of Gender, Labor and Social Development. We also need the Ministry of Energy, Transport, Communication and Agriculture. So we want to work together with these ministries to address many of the things that concern and promote a healthy Ugandan. But also to fight and reduce this mortality for mothers and infants further, I would like everybody to participate, including the community. So we are creating more community awareness of the plight of women and of the dangers that women may encounter when they are pregnant. This is a well-known fact that of the pregnant women, 15% will go on to develop complications. And it's these women who have complications that often die. But now we want to reduce that death even further by involving the communities. And also, we want to launch a campaign that every woman in Uganda will give $1 per year to this cause. And maybe we want to include the men also.
Yes.
To join that campaign with us. Our First Lady, Honorable Mama Museveni, Janet, has already signed up to that, signed up to a petition to promote this cause that AMREF is already addressing of, standing up for the African mothers. So I would like all of us to join that cause and sign up for the woman midwife who has been nominated for next year's Prize Award.
Honorable Minister, thank you. Today is a remarkable historic day.
Yeah.
Your presence at Deauville in France on the 13th of October 2011 has signified for me a new chapter in the cause for the mothers of Africa. I think for many years the world has come to know Uganda for its leadership in the fight against HIV/AIDS. And here we are again in a new dawn with your leadership. and your presence here, and they can see the excitement and the enthusiasm of everyone's part, and the fact that you've been able to make it to launch this global campaign on maternal child health, Stand for African Mothers, and of course the statement that the First Lady of Uganda, Honorable Mama Janet Museveni, has signed. Maybe your messages to the world, having been here, having launched this campaign for which AMREF is so grateful, what do you like the world to do for the campaign?
First of all, I would like the world to know that we have a great leadership. To follow on your point about HIV/AIDS, our country was able to do a lot concerning prevention and care of HIV/AIDS because of a great leadership. We have a president who is all out to help his people. And joining him is the First Lady, also for this cause. Now, even with maternal mortality and many other health indices that we want to improve in our country, the president is already pledging his leadership once more. And so, because of this good leadership in my country, we also follow suit. You know, when you are bossed, when the appointing authority, when the president is in for something which you know is good, then it also gives you the morale to go ahead and to pursue that. But more importantly, also, I want the world to know that as Uganda, we are dedicated to work closely with partners and with everybody else who will care to join us to reduce the maternal mortality rate and also meet the Health Millennium Development Goals by 2015. We also want to join partners like AMREF, who is helping us and, you know, adding on to already what government is doing by training more health workers, especially midwives, to reach the rural women so that they deliver and have safe, you know, pregnancy and safe childbirth, so that in turn we have children who have mothers to take care of them. And we also want the world to join us in this campaign. If you can spare $1 per year for the women of Uganda, we will be very, very grateful. And we want to assure the world that whatever funds that you will forward to us, we promise and we pledge to look after it very, very well. And of course, with partner like AMREF that we're working closely with. Through them, we will account for every dollar that will be forwarded to us.
Thank you, Honorable Minister. We've been extremely privileged as AMREF to have you here at this launch, and obviously, what a day. This campaign led by a very committed, very passionate, extremely dedicated Minister for Health, female Minister for Health for Uganda, symbolizing the leadership across the continent. Is a great day. Thank you, Honorable Minister. We appreciate so much your great help.
Thank you.
God bless you.
Thank you so much. God bless you.